Hello, my name is Karina. I work with parents to support their breastfeeding journeys. You may need to support your breast with your free hand to take the weight of your breast from your baby's chin. This allows them to breastfeed more effectively. C-hold. Support your breast with your thumb on top away from your areola and the fingers underneath. Your fingers should also be well back from your baby's mouth. This hold is helpful when breastfeeding in the rubber position, as well as the cradle position. U-hold. Place your fingers flat on your rib cage under your breast, with your index finger in the crease under your breast. Drop your elbow so that your breast is supported between your thumb and your index finger. Your thumb should be on the outer area of your breast and your fingers will be on the inner area. This hold is helpful when breastfeeding in the cradle position. Some other tips to try to support your larger breast when breastfeeding is to use a rolled up muslin, towel or thin blanket under the breast to support and lift it so you can better see baby's latch. Sitting cross-legged and having pillows on your lap to hold baby means you can support the weight of your breast when feeding. If you can't see your baby at the breast, sit side onto a mirror to look at the latch. Visit beside you for more advice and support, including details of local breastfeeding support drop-ins.